Hypothyroidism is a condition where the thyroid doesn't create and release enough thyroid hormone into your bloodstream. This condition affects the endocrine, cardiovascular, nervous, respiratory, digestive, and reproductive systems. Also called underactive thyroid, hypothyroidism can make you feel tired, gain weight, and be unable to tolerate cold temperatures. When you have hypothyroidism, your body makes too little of the thyroid hormones T3 and T4. These hormones control your metabolism. They affect the way your body uses the energy, and as a result, many of your main body functions change and can slow down. The most common cause of hypothyroidism is an autoimmune disorder known as Hashimoto's thyroiditis. A surgical removal of part or the whole thyroid, radiation treatment of the thyroid, or thyroiditis, which means inflammation of the thyroid.
With hypothyroidism, it works as a negative feedback loop. So it starts out with the T3 and T4 levels decreasing below range. That stimulates the hypothalamus to release TRH, thyroid regulating hormone, which then stimulates the pituitary gland to produce TSH, thyroid stimulating hormone, and that causes the thyroid gland to produce excess hormones, causing the rise in blood levels. The rise in blood levels cause the hypothalamus to shut off and stops the TRH secretion. That prevents the pituitary gland from releasing TSH. Some signs and symptoms of hypothyroidism to look for in one of your patients would be fatigue, so if they're feeling weak or tired, maybe some aching, some weight gain, bradycardia, constipation, so monitor bowel movements just to make sure, kind of get a trend of what they're used to, some shortness of breath, decreased appetite. A lot of times they do feel like they're cold, so they're cold all the time, their extremities are cold, some dry skin and hair, maybe brittle nails, memory loss. I've also included a little picture to kind of help y'all have a mental image of what it would look like in the next slide.
When having patients or clients with hypothyroidism, we want to provide, sufficient amount of diagnosis tests. We'll start off first by our TSH, and our TSH comes from our hypothalamus, which is a gland in our brain, and it comes down to our thyroid, which produces TRH, which is our thyroid releasing hormone, which is a message under the anterior pituitary gland that produces TSH and directly stimulates the thyroid. Then the TSH produces T4 and T3, which is our thyroxine and our triiodothyronine, and that needs to be the T4 needs to be converted to T3, and that's what the liver does mostly. So sometimes when patients are taking the medication, levothyroxine, as many of you have seen in clinicals, sometimes if that medication isn't working and they're not making sufficient of that T4, then that can indicate that they have something going on with their liver. Hypothyroidism is also known to affect our calcium because of the homeostasis, decreasing the bone turnover and serum calcium levels. So we want to make sure that we watch out for that and for tetanus. Our PTH also regulates our phosphorus, and if we have too much phosphorus in the bone and blood, that can often be a sign of kidney damage. And our our ECG, our electrocardiogram, is associated with increasing incidence of atrial arrhythmias and changes in the QT interval. So that's why the ECG is also part of our diagnosis test. And going back to our T3 and T4, I do see sometimes doctors putting in orders for T3 and T4 total, or T3 and T4 free. So those are total hormone quantities. That includes the T4 and T3 for the thyroid hormone to be moved around the body. And it first has to be a bond to a transport protein. And the vast majority of the T4 and T3 is found in this bound state. So the total T3 and the total T4 is a calculation basically of all of the bound hormone, which gives us like a good idea of how much production is being generated by the thyroid gland. I set a picture on here just to kind of give you guys an idea what foods to consider when taking care of somebody who has hypothyroidism. I will state some of the things on here should be very limited. For example, for the vegetables, cauliflower and broccoli should be limited if you are having somebody who has iodine deficiency as well. If they have iodine deficiency, it blocks the thyroid's ability to use the iodine for normal thyroid function. One way you can help with that is steaming the vegetables, or maybe cooking them, which will reduce that. Another one is onions. So onions should be very, very limited, if not, not considered at all, because it reduces the hepatic deiodinase, which is a liver enzyme that is required to activate the metabolism of the thyroid hormone. Another one that should not be consumed is the soy, because of the chemicals. It can be linked to the thyroid disorders. And gluten. Gluten should not be consumed, very as much, just because if you're taking a hormone replacement like levothyroxine, it can cause problems, especially since you are supposed to take that medication on an empty stomach. And if you are gonna, consume any like carbs or anything, you should consume the carbs, way, 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 way before you take that medication. You basically have to be fasting to take that medication. If not, take it either very, very early in the morning, so that way you're not having any complications. Another one is fruits. Fruits like cherries, peaches, and pears, plums, raspberries, and strawberries should be limited as well.
Medications. Levothyroxine Synthroid is a synthetic version of a hormone called thyroxine. It replaces thyroxine if your thyroid gland cannot produce it and prevents the symptoms of hypothyroidism. With this medication, you want to take it first thing in the morning on an empty stomach to prevent insomnia and absorption. You want to monitor vital signs, the liver function, and thyroid function. You want to report if you have any of these symptoms, such as chest pain, insomnia, tiredness, headache. And then the other medication, which is Liotrix, is also used to treat hypothyroidism, and it can also help decrease the size of an enlarged thyroid gland known as a goiter, and with thyroid cancer. Also, with this medication, you want to take it first thing in the morning as well. It helps control hypothyroidism, but it does not cure it. And with this medication, it takes several weeks before you can feel the full benefit of it. And these are the medications for hypothyroidism. Complications. Untreated hypothyroidism increases chances of heart failure, hyperlipidemia, increased bad cholesterol, and then decreased HDL, which is your good cholesterol, due to metabolic changes. And then you have insulin resistance, diabetes, thyroid cancer, and then myxedema coma, which is a life-threatening complication.
due to severely low thyroid hormone. It can be caused by abruptly stopping hormone medication or thyroid removal. And these are your complications.
So for question number 1, what are signs and symptoms of hypothyroidism? We have A, fatigue, B, weakness, D, dysrhythmias, D, weight loss, and E, weight gain. So A, fatigue would be one, B would be another one, C is another one added, and for the final one is weight gain. And we are gaining weight because our metabolism is slower.
A nurse is collecting data from a client that is recently taking levothyroxine to treat hypothyroidism. Which of the following findings should indicate the nurse that the client might need a decrease of the medication? A. Hand tremors. B. Bradycardia. C. Pallor. D. Slow speech. The answer is A. Hand tremors because the medication might be a high dose.
A nurse is reviewing laboratory results of a client who's being evaluated for secondary hypothyroidism. Which of the laboratory findings is expected? A. Elevated T4, B. Decreased T3, C. Elevated stimulating hormone, and D. Decreased cholesterol. So for this question, it's going to be decreased T3. As we stated earlier, in order for somebody to be diagnosed with hypothyroidism, is both T4 and T3 need to be decreased.
A nurse is collecting an admission history of hypothyroidism. Which of the following should the nurse expect? Select all that apply. A. Diarrhea. B. Menorrhagia. C. Dry skin. D. Increased libido. E. Hoarseness. And the answer is B, C, and E. Those are the admission history of hypothyroidism.
A nurse is contributing to the plan of care for a client who has myxedema, coma. Which of the following actions should the nurse include? Select all that apply. A. Monitor daily weights. B. Observe evidence of urinary tract infection. C. Record input and output. D. Initiate aspiration precaution. E. Provide warmth using a heating pad. A, B, C, and D, obviously they're the correct answers because they indicate effective therapy.